The coronavirus pandemic now, and health experts have raised doubts about the COVID-19 vaccine produced by British drug company AstraZeneca and Oxford University. They say a manufacturing error during the trial process makes it difficult to assess its effectiveness. More than 2,500 volunteers received half a dose followed by a full dose. In this group, the vaccine was said to be 90% effective. Nearly 9,000 others received 2 full doses, and in this group, it was 62% effective. AstraZeneca says when combined, the results showed the vaccine is 70% effective. But Oxford University now says that some of the vials used didn't have the right concentration of vaccine, and that's leading to questions about the validity of the results. The university says it's discussed the problem with regulators and has agreed to complete the late-stage trials with 2 groups. Let's speak to Mohammed Munir about this. He's a virologist at Lancaster University and is Vice Kite from Lancaster. Always good to have you on Al Jazeera. There was a lot of hope that the Oxford vaccine could be a game changer, of course, globally, because it's cheaper and more easily stored than the Pfizer and Moderna vaccines. Now, AstraZeneca and Oxford say there was a manufacturing error. What does that mean, and how much does it undermine the overall results?
Yeah, well, thank you very much, Polly, for having me on the show. Certainly, the results are encouraging, but those are confusing and require quite a lot of interpretation before we can count heavy onto this AstraZeneca vaccine, particularly because the data has become only available either through the press releases or through the newspaper. So until the original data is not available, it would be really hard to pin down independent opinions. But having said that, the error that the manufacturer has made and then the trial was carried on is certainly something really concerning, because the half dose could have gone into double dose. That would jeopardize the whole volunteer recruitment within the trial. That is certainly of concern. And one of the problem is that the low dose regime has been only in a very small number of people, 2,800 people, and none of them is over 55 years old. So this put a question mark. Even if it is 90% effective with lower dose, would this still be valid enough to be deployed into the field for larger population when it is tested on a small scale?
And what was quite surprising also is that the group of volunteers apparently that got a lower dose seemed to be much better protected than those who got 2 full doses. How do you explain that?
Yeah, absolutely. We don't really know the molecular mechanism behind why this is the case, but it's probably just finding a right balance between the antigen, which is a spike protein of the coronavirus, that it doesn't overwhelm the immune system, but induces the enough immune responses that are sufficient to neutralize the virus when it comes into the vaccinated people. But that is something is being explored. But I think most of the vectored vaccine, which include Sputnik 5, Sinovac, or Johnson & Johnson, AstraZeneca, all these vaccines would have the same problem, that because these are vectored vaccine, which means there is another carrier that is taking the antigen of the virus onto the human body. This will always be a problem that need to be sort of settled before really we move on.
Are these confusing results, do you think, likely to affect AstraZeneca and Oxford getting the approval for their vaccine in countries like the US, for instance?
Oh, yeah, absolutely. Very important point, because if we look on to 62% efficacy, that is based on, say, 9,000 volunteers being trialed. That is probably good enough to be looked at, but 62% efficacy isn't really acceptable compared to 95% by Moderna and Pfizer. And if we talk about 90% efficacy, that is only trialed on 2,800 people. That isn't sufficient enough for the regulatory body to approve it.
Right.
So either they settle the matter on to 62%, which wouldn't be very impressive, or if they go for 90%, it would not be approved.
We know about the efficacy, but what we don't know, as with the Moderna and Pfizer vaccine, is whether, how long it will last, the immunity of these vaccines. Is it any clearer to you?
Oh, absolutely. That's a very important question. I mean, we don't know at the moment for how long the immunity would last, because the only data that we have about the kind of immunity and the longevity of these antibodies into the human body is only few months. And anything beyond few months is really something that we don't know. Based on the natural course of infection, we do know the antibodies last from 8 months to 12 months. And also the same case we have observed previously in coronaviruses in SARS and MERS. But particularly speaking with the vaccine-induced immunity, we don't really know how long it would last. And that is one of the concerns. Probably we need to repeat the vaccine every year, like the flu jab.
Mohammed Munir, always good to get your thoughts on this coronavirus vaccine issue. Thank you so much for joining us there from Lancaster University.
Pleasure to be here.